ever thought about getting a dental implant or implants and that they might not be right for you? Well, there is a variety of reasons why you may not be suitable for dental implants or they may not suit you. I'm going to go through those reasons in the next few moments to hopefully give you kind of an understanding of whether or not it's something that you should or shouldn't consider. So an implant looks something like this. Obviously much smaller because it's got to fit into the jaw. Essentially what it is, it's usually made of titanium. There are implants that are made of zirconia, and there are implants that are a mixture of titanium and zirconia. And then you might get other ones that have some small amounts of metals included in them. And the idea of this is it makes them a little bit stronger. So what we do is, as long as you've got enough bone, we will put the implant into that bone. And then depending on what technique we're going to use, we will stitch the gum back over the top. And conventionally, we'll leave the implant there for a number of weeks, 6, 8, 12 weeks, because bone is very slow to grow and it needs time to knit around that implant. And that process is called osseointegration. There are other techniques that you may hear about where an implant is placed immediately after a tooth is extracted, which we can sometimes do. On occasions, we can also what's called immediately load the implant, which means that the implant is placed and we can put a tooth or teeth on top of those implants on the same day. All these processes involve lots of planning, so we need to prepare for that, and everybody's individual, so we need to understand what can and what can't work for you on an individual basis. In terms of the conventional process, though, that's where the implant is placed into that bone. And then because bone is very slow at growing, it takes that time to knit around the implant and lock it into place. However, once that implant is locked into place and it's nice and stable, it's what we call that integration, it's integrated, we can then look at what we do to put something back on top. So for instance, we might put a single tooth on, we might join a couple of implants together with a number of teeth, 3, 4 teeth or so, such as a bridge. We can also do the whole jaw. So we're able to link 4, 6, 8 implants together and give you a full set of teeth in the upper jaw or the lower jaw. And sometimes we can put little attachments on top of the implants, which means that if you have a denture that is loose and is not stable, that we're able to place an implant in the jawbone, put a little attachment on top, and then there's a little special, what we call a housing, that sits inside the denture, and then the denture is able to clip in and out. So that increases the retention of that denture. So you're able to use that denture more effectively. So what we're going to do is we're going to go through from start to finish the implant process in some detail. But firstly, what makes somebody sort of suitable for implants, or an ideal candidate for implants, let's say? Well, it's somebody that is very, very healthy and essentially has lots of nice, healthy bone. But that doesn't mean that anybody that is unhealthy or doesn't have bone can't have an implant. But there are certain factors that sort of influence the decisions when talking to you about implants. One of those is smoking. So there's certainly some evidence that suggests heavy smokers have a negative impact on implant success. Uncontrolled diabetes. With diabetes, what's happening is that the capillaries in people that have uncontrolled diabetes are unable to get the blood to certain areas, which is why they sometimes have problems with their fingers and their toes, and they're healing it as a whole. So essentially what we're doing is we're putting that implant into bone, and we need that bone to heal around the implant, not just when we've put the implant in there, but over the next few months as everything heals, and then for the rest of the implant's life. And if somebody has uncontrolled diabetes, or if you have uncontrolled diabetes, then your ability for that bone to heal and those tissues is compromised. Gum disease, periodontal disease is another factor that can influence the short and the long-term outcome of implants. And there are various methods that we can help if you do have existing gum or periodontal disease. There are some particular medications that can affect bone. So this might be another factor that influences our and your decision on whether implants are suitable or not. Bisphosphonates are a group of drugs that can affect how the bone heals over time. And depending on the dose of the bisphosphonates and how the bisphosphonates are being provided, whether they're intravenously or orally, can have an influence on whether an implant is suggested or not. And also other drugs that can affect your metabolism or antimetabolites, such as methotrexate, also have an influence on the way the bone heals. So there are many, many medications out there. And again, we can sort of go through in detail when you have your consultation about these medications and how they could potentially negatively impact on your implant success. Sometimes people worry whether or not they have enough bone, and obviously bone is important. We like implants to have bone surrounding them all the way around. And so we need what we call bone volume. The height and the width of the bone is helpful. But that doesn't mean if you're missing bone that we can't help you out. We can do a procedure called an augmentation, where we can put bone back. We have the ability to expand the bone as well. We can also increase the density of the bone should we need to. So there are many sort of tools and techniques that we can use if you are missing bone to help you put bone back. But again, in an ideal situation, what we want before we place that implant is plenty of bone there, which is always helpful. We don't always get that. So sometimes we do need to do what we call a standalone augmentational graft, where we'll put the bone back first, allow that to heal. Again, that takes time, and then place the implant at a later stage once that bone's healed. And also the gums and the soft tissues, it's important that we have the right type of gum around where the implant is going to emerge and the new tooth or teeth are going to be, so that you can keep it nice and clean without it being uncomfortable, and effectively maintain that plaque around that implant junction. So there's lots of factors there that we'll discuss and help you make a decision with. So we have lots of tools that we use these days to help us provide you with a successful tooth when we're looking at implants. We have the use of intraoral scanners, which is like a little camera that goes around and it maps out the teeth and the gums and the spaces. We can combine that with what's called a CBCT scan, which essentially is a 3D X-ray. So that shows us the height and the width of the bone. What that allows us to do when we put the two together is it allows us to put the tooth in the ideal position for you, or teeth, or if we're doing bridges, or if we're doing the full arch or the denture work that we're considering. So we can work out where the optimal position is for those teeth or the bridges, and then we can then figure out where the ideal position for the implant is. And then we can consider whether or not we need to do that augmentation procedure, make sure that we're looking at the anatomy, sinuses in the upper jaw, nerves, blood vessels, etc. And it's just changed the way that we can help you with the implants. We can then get a little guide made, which guides where that implant is going to go, which makes it much more safer, less risk involved. Age, sometimes people ask, am I too old for implants? And there really is no sort of upper limit for patients with implants, as long as all the other factors are there. The health that we've mentioned, the bone volume. Um, we've placed implants on patients that are 95 and been very successful, and we've improved their quality of life, which is what they were looking for. In terms of the younger side of things, however, there is sort of a cutoff point that we look at. If we talk in generality, then that might be, for instance, 20 for women, and it might be 25 for men. But essentially what we're looking at is we're looking for the end of that growth phase, because once we put the implant in that jawbone, that's where it's going to stay. And if we do that at such an early age where the jawbone is still growing, which it does to a sort of a slower extent as we get older, past that age that we mentioned. But if we put that in at a really early stage, then that implant is going to stay in that position that we place it in, and the rest of the teeth are going to move over time, over those years. And that implant could then become problematic. It could potentially cause issues with the other teeth, because it's going to stay put and the other teeth are moving into their sort of natural position, if you like. So it's something that we sort of look at, and something that we consider sort of delaying that implant process until that sort of growth phase is finished and we're coming into sort of a more early adulthood. Also, we've got to consider that implants, they're not for life. They don't last forever. So the earlier we have them, then unfortunately, the earlier that they're going to need to be replaced. Although we do have a huge success rate over sort of 10 to 15 years, we're looking at about 98% success rate. But it does mean that the more that we can sort of delay that, then and use other options such as dentures, bridges, then that might be more suitable for their younger patients. To smokers, and certainly it is a risk factor when it comes to implants. Again, people that smoke, their capillaries, just like we talked about with the diabetics, sort of can close up, and then the blood flow to those bone cells, those tissue cells, is impeded. So we get impaired healing. There's lots of evidence out there, you know, that sort of suggests there is an impact negatively with people that smoke. Again, it doesn't mean that you can't have implants, but we can hopefully help you and sort of guide you through that. So, if we can reduce the amount you smoke, there is a dose. So people that smoke more than sort of 15 a day, we're certainly seeing a higher rate of issues with implants. Less than sort of 10 or below that, less of an impact, but it still has an impact compared to people that don't smoke at all. There are ways that we can talk about helping you out with sort of quitting smoking, moving away the patches, other options that are there and available for you. One of the things that we do often find, though, is patients do come in and they are motivated to stop smoking. There's a big investment with the implants. There's the time that there's investing. There's obviously the cost that is being invested. So this means that they have that incentive to finally give up on the smoking and then save money. And so it is for some people sort of the kick that sort of takes them sort of past that sort of stoppage that they've had in the past where they haven't been able to quit. And then sort of the other factor is that bone sort of quality. Is the bone really soft? Is the bone really dense? Something that we look at with the CBCT scan to some extent, gives us sort of an idea. And then really important is motivation and oral hygiene. So implants, they do need to be kept clean. They don't decay like teeth. They're made of titanium, so they're not susceptible to tooth decay, but they are susceptible to bone loss potentially like a tooth. So they do have to be kept clean. And you're investing in an implant, so you need to be invested in your oral hygiene measures. So the correct toothbrushing techniques and the correct interdental aids that are specific for your implant or implants that help maintain and keep that plaque away from the gum. Because what we don't want is we don't want plaque around that implant crown. That can lead to something called mucositis, which is an inflammation of the gums, very similar to gingivitis with teeth. And also you can get something called peri-implantitis, which we see where there's a loss of bone. Although we don't fully understand it, we do feel it is highly linked to poor oral hygiene and plaque buildup. And one of the things that we try and do for patients that do develop peri-implantitis is to disinfect that implant surface through various techniques. So yeah, oral hygiene, keeping the mouth and the implants as free from plaque as possible by using those techniques. So how does the process work? Well, we have an in-depth consultation that may be initially with one of our treatment coordinators or with ourselves. We will do the intraoral scan if we think that's appropriate. Refer you if we also think it's appropriate for that three-dimensional CBCT, that three-dimensional X-ray, so that we can look at everything, plan everything, understand the anatomy, the bone formation, whether you have enough bone, again, where the sinuses are, if we're looking at the upper jaw, certain nerves, certain blood vessels, to make sure everything is safe and appropriate. And then as we sort of go through the process and answer any sort of questions that you may have, any concerns, go through those in detail. And if you do have any questions, then please drop us a line. We talk about the alternatives. So it may not be that implants are the appropriate solution. There are other alternatives out there. If it's a space that you're looking at, maybe just leaving the space as it is. If you're looking at a denture, then maybe a denture is more appropriate. Bridges, there are various types of bridges, various designs. They may be more appropriate for your situation than an implant. And again, we'll discuss that with you. So we're really interested in what your wants and needs are, what you're trying to achieve, what you're kind of looking for, to make sure that the implant solution is the right solution for you. We're looking at aesthetics, or we're looking at function, are we looking at both? What are you looking for? Something that's fixed? Are you looking for something that's removable? All these factors come into that consultation process so that we can guide you through the process and hopefully give you the correct advice and guide you on your implant pathway. Well, thank you very much for listening. I hope you found it useful. There are other videos with lots more information on there. Take care.